At Contra Costa Regional Medical Center and Health Centers, we embrace the voices of patients, family members, and our community in our improvement efforts. We see their perspective and their voices as essential ingredients in creating a patient-centered health home that's respectful and accessible to everyone in our community. I think in the past that we have had a fear in including patients and family members in conversations and decisions around redesign and improvement activities. A fear we wouldn't be able to manage the conversation or meet the expectations. Involving patients and family members in the decision-making process does change the conversation. It changes it for the better.
While I recognize that a lot of providers aren't used to and comfortable with having family members and patients at the internal meetings inside, I feel that it is a shared responsibility for all of us to work together to seek improvements. And I've seen the magic that can happen when people lay down their tools and that aren't working and come together.
Have you ever had experience that anywhere, in a store or some organization, like you feel really kind of upset and you're thinking like, I would tell you everything that I think right now, but I don't have time, or I just don't want to make a fuss of it or something like that. This is my time and this is my fuss. So I can tell everything that I think and try to make it work not just for me. My mom also comes to this hospital for my mom, for my kids, and for other people too.
At Contra Costa, I think we're now beginning to understand how to have more meaningful relationships and meaningful conversations with patients and family members. Focus groups and surveys have been what we've relied on for the most part in the past, and those are really important tools. But actually putting patients and family members side by side with staff, working to improve the process, design teams, decision-making teams, that is what can bring about powerful change.
Just to hear some of the stories that the patients share. It is so compelling. You want to do things differently. One of our patients came and shared a story with me, and she had mentioned how when she comes to register here, at the hospital, she's in one area, and then she has to walk clear across on the other side of the campus to go to her physical therapy appointment. And she says, that is kind of painful for a person that just had joint replacement surgery, and that was kind of like a huge aha moment for us. And it's like, that's the kind of things that we need to really look at and take in consideration, for our patients and families.
I think that we've always designed our systems with the best intentions to provide the best care possible. I think we've been doing that, though, without the voices of the patients and family members. Our systems belong to the patients. So by putting the patients and the family members, by bringing them in as partners, we're better able to design systems that provide what they want and they need. And that's why we should do this. That's why we should include patients and families as partners, because these are their health systems.
This is a partnership. It's not our hospital, but, it's our hospital.
It's important that we make our voices heard as patients, because the clinics and the hospitals, they can look at it from a professional scale, but they can't look at it from a patient's perspective per se, because they're not the patient.
I'm sure a lot of people think that they're really good and they do their best. And they probably try to do their best, but probably their best is not what we need.
So while I have great respect for the knowledge and expertise of our clinicians and providers, patients and families really are the experts of their own health.
As we're involving patients and family members more and more in the improvement work, we're seeing the demand from staff to have patients on their improvement teams. We're seeing that demand increase. And in every case where we've included patients and family members, we've seen powerful results, both in the inpatient and the outpatient.
When we really first started this journey, everyone was standing back and just kind of hesitant and just waiting to see what was going to happen. Now I'm just getting staff calling, I need a patient on my team. Is there someone that can, help us?
There has been a cultural change. If we were today to say, we're not going to, we've decided we're not going to involve patients and family members anymore in our work, I think we'd have an outcry from staff that there's no going back. This is the way we do work here at Contra Costa Regional Medical Center and the health centers.